Good morning, everyone. Welcome to the 10th Malaysian Hybrid Conference on Healthy Aging. I would like nothing better than to age in a healthy manner, and I'm sure most of us feel that way, and we would like to help other people to do the same. So, this is a wonderful conference, and I wish I could join you in Georgetown, Penang, my mother's hometown. However, um, I would like to share my experience in hypnotherapy and how I think that it could help you yourself to age in a healthy manner and your patients to age in a healthy manner. I would like to tell you about my experience with hypnotherapy. For those of you who think that hypnotherapy is a party trick, I would like to correct you on that and to tell you what exactly it is, how it is done, and what it is generally used for, and what I think that it could be used for, how we could get trained, and how it's being used in research. Also, I would like to bring in this idea of healthy aging and how hypnotherapy can help you with that as well. I'd like to tell you about my experience with hypnotherapy. That started when there was a talk at University Malaya by Ms. Sheila Menon and her colleague from the UK. And it was very interesting. And I decided, okay, let me enroll in a basic course. So I learned a little bit. I roped in my research assistant and my daughter and my husband as well. We all went for this course. And following that, I did the diploma course as well. And we did a course in NLP. And following that, several short courses which were advertised for specific problems that we could help other people with. And Nosarel became the host for several courses after that, until probably the present day, except that now it's become more virtual because of the COVID situation. Nosarel is the Center of Excellence for Research and Learning in Orthopedics, which is at University of Malaya. Hypnotherapy attracted a great many interesting people, and I made many friends, both from the teaching faculty, Miss Sheila Menon, who's still a good friend of mine, Dr. Alan Hanan So, who is a superb hypnotherapist and as well. And there were people all the way from psychologists to people who were hurting and wanted to be healed, to people who wanted to help other people, all the way to the curious people who just wanted to learn about this interesting field. So, following these courses, we did some research at the hospital and we used hypnotherapy for pain relief. And we did some research on that. We also did surgery using hypnotherapy instead of anesthesia, which was very spectacular, and I'll show you some of that later. Following that, my research assistant, Ms. Nur Izzati, took her master's in a topic which was related to hypnotherapy. And this is Nur Izzati getting her certificate from Miss Sheila Menon in the hypnotherapy certificate course. And in the purple is my daughter listening to Izzati giving her graduation speech, which we all had to do. And it was a very pleasant and eye-opening experience. Nur Izzati did her master's, and her title was A Comparison of Two Modalities in the Management of Chronic Brachial Neuralgia. So the two modalities were firstly acupressure, and we got hold of an acupressure specialist who was able to find the meridians of the acupressure and paste some discs along the meridians, and it was quite incredible to see that some of the patients responded almost immediately to these acupressure discs. And we compared that to hypnotherapy, where we did several sessions of hypnotherapy for a month on several patients. We actually randomized them and we treated them either with acupressure or hypnotherapy. And the patients with brachial neuralgia are severely disabled because it's a terrible pain that you get when you have brachial plexus injury. And we try to give them some mobility back by surgery, etc. But the pain is something that I would dearly love to solve. This is a graph of what happened to these patients. And we followed them for 1 month before, and then we followed them during the treatment and after stopping the treatment. And you can see that the pain reduced significantly in both groups. More in the acupressure actually, but it caught up after stopping the treatment. And I think this was a very useful piece of research. So what happened was that 100% of the subjects suffered poor quality of life, and 55% had a positive depression risk. And we found that there was about 28 to 30% of pain relief that was felt in both groups. And the pain relief was significant even after we stopped the therapy. Acupressure worked faster than hypnotherapy, and everything went a little bit backwards after having stopped the therapy. The acupressure patches had a little bit of redness after a while, but that was not a problem, and both modalities were safe. So these were her conclusions. There was significant reduction in visual analog scores and improvement of quality of life, and both were unable to retain the same level of pain relief, but it was much better than before the treatment. And the scores were better in the brachial plexus health survey. Hypnotherapy actually improves mental health for up to 4 months post-treatment. After that, we didn't measure it. And acupressure is a bit faster with a few less carryover effects, and also improves general health. Following that, we used hypnotherapy for surgery without any anesthesia. So we did carpal tunnel release without any anesthesia and under hypnotherapy. However, the patients had to come 3 times for 3 hypnotherapy sessions prior to the surgery, and they were gradually trained in coming under a trance, and a needle was put in without their feeling the pain, etc., until finally the day came for the surgery. Now, there were about 12 patients that we did this on, and most of the patients managed to carry on. We did tell them that if you have any pain, let us know and we will give you some local anesthetic. And we had 2 or 3 patients who had a phobia about surgery, and even they went for the surgery, but 2 of them had to have a top-up of local anesthetic. And this is the video showing the surgery on this gentleman, carpal tunnel release, and how he responded following the surgery and during the surgery.
Dia habis operation.
Happy dah habis operation. Tadi saya nampak kamu mula-mula selepas operation, kamu rasa macam tak tahu kamu sudah mengalami operation. Adakah itu benar?
Tahu tak, masa tu memang tahulah ada operation, tapi tak sedar benda tu dah habis.
Tak sedar betul habis. Dari semasa operation sehingga sekarang, adakah kamu rasa sakit sedikit ataupun tak sakit langsung?
Ada sikit saja. Sekarang ni pun dah tak sakit lah.
Sekarang pun tak ada rasa sakit.
Tak ada.
This was the newspaper clipping. And our team was Dr. Ellen Hanan So, Dr. Terence, myself, and of course all the support team, including Izati herself. And it came out in the newspapers. The patients were quite happy with this. And another picture of a patient following his interview by the newspapers. This gentleman was a hypnotherapist himself, and he requested that I remove the wires from his finger that were placed when he was less than 10 years old. So that would have been more than 10 years before the day of the surgery. So these wires were deeply embedded, but I agreed to do it, and he put himself under self-hypnosis, and I really had to tug and pull very hard, and he didn't move at all, and his blood pressure was maintained, which is a very good part of hypnotherapy, because with hypnobirthing as well as hypnotherapy for surgery, when your blood pressure is stable and you are calm, then there's less bleeding and there's less chance of complications. So, hypnotherapy is actually inducing a trance like state. So, if you can imagine how you feel when you've just woken up, you're awake, you're aware, but you're in a bit of a trance. And also, sometimes when you're driving the car on a route that you are very familiar with on the way home, you're awake, you're aware, you can maneuver the car. If something comes in front of you, you would be able to respond, but you are not, you are in a little bit of a trance. So that is what hypnotherapy is. And you can make use of the power of your mind. Actually, it's a huge thing that we are not using much of. In fact, it's likened to a huge block of ice where you can see the iceberg on top is a tiny bit, but the amount under the water is enormous. So the power of your mind is quite enormous, and you can achieve quite a few things by trying to manipulate it in this way. And so, how is it done? Well, you sit relaxed in a chair, with both feet on the floor, and there's a script which is read to you. You are usually asked to close your eyes, unless the technique that they are using to hypnotize you involves you looking at something. But usually you have to close your eyes, and there's a script which can be fixed. There are certain fixed scripts, or it can be personalized to you, and it brings you on a journey. Sometimes it brings you down a set of stairs, through a gate into a garden. Sometimes you can symbolize things like gathering of fruit for gathering of knowledge. And you can do all sorts of imaginary things. You can gather a huge amount of knowledge and pack it into a small little container and bring it into your heart. All sorts of things can be done. And then after you have done this journey around your area that has been chosen, like a hill or a garden or somewhere beautiful, then you will come back the same way. And as you come back up the stairs, you are told that you're going to wake up rejuvenated, you will be fresh, you'll be ready for the day, and all parts of you are back where you were when the session began. So that's the whole journey of a hypnotherapy session. And it can go on usually for an hour or even a little bit more. But it depends how you are progressing and your hypnotizability. And so how do you get trained to do hypnotherapy, or how do you have a hypnotherapy session done on you? Well, you should get a qualified hypnotherapist if you want one. And you can even qualify to become a hypnotherapist yourself. The school I went to was, as I mentioned earlier, the London School for Clinical Hypnotherapy, which is in Kuala Lumpur here, or a branch is in Kuala Lumpur. There are many training centers and different styles. There's American style, there's a British style, etc., etc. And they offer courses, diplomas, other certification. So, coming down to aging, I would say aging is best and happiest when you are mixing socially, when you're helping others, and hypnotherapy can be a tool. And you can even become a trainer in hypnotherapy. And what can hypnotherapy be used for? Some people use it to stop smoking, but you need to want to stop smoking, and it can be done in one session. You can use it as a weight loss adjuvant. You can use it to help your sleep. Anything that requires your mind to amend something. There's a very strong hypnobirthing group that does giving birth under hypnosis. And for healthy aging, let me see, if you are not as healthy as you were, You may need to come for checkups. You may need to take blood or have a drip set. All that is more pleasant when you are in a state of mind where you can say, this is not pain, this is actually just a very unusual sensation. And it becomes more pleasant and bearable. There's another thing which you can do is to help promote healthy living, because sometimes we don't encourage ourselves to do that. So hypnotherapy can help you to try and stop smoking, to try and exercise more, to eat healthier food, and of course to reduce anger and stress issues as well, to try and make your later years less stressful, more peaceful, and thus healthier. There's another side of hypnotherapy which you can go to try and sort out all the pains and hurts that you felt that were caused in the past. And sometimes these cause what is called an ab reaction. It's not something you do with your belly, no, not belly dancing. It is actually it's actually a response where you start crying, or it's a very strong emotional response. And that happens when sometimes you go back to your childhood and try and heal something which has happened in the past. Now, that would be a good reaction to have, actually, even though people say don't crying is not a good thing, but ab reactions, let it out and you feel much better after that. I've seen many people who feel they have been healed slightly by these ab reactions during hypnosis. So, ladies and gentlemen, how can hypnotherapy be a tool to help you with healthy aging? Well, you can have sessions of hypnotherapy to help you get along in life. You can become a hypnotherapist within a few months, and it can be a useful new toy, especially the self-hypnosis part. It can help you over the painful parts of life, of which there are many as you age. It can help you with loss, it can help you with grief, it can help you with health bumps in the road and stressful parts of life where you can remain calm. It can improve your resolve, and taking a course will help you make new friends, which is also very good for healthy aging, and it can give you a nice new tool that you can work with.